So look, I'm really happy today to be talking to Janice Quadrio from Selectability. She is a mental health worker and a social worker that provides fantastic services in Mackay. So welcome, Janice.
Thanks, John.
Nice to see you again.
Yes.
So before we start, can you tell us about your own qualifications and what are you doing in the area of drugs and alcohol?
Okay. So I'm a social worker, and I've been a social worker for over 30 years. So very much a systems approach, so looking at the person within their context, their social and environmental context, and that works very well in the area of alcohol and drugs. In fact, I think if you don't take account of that, you've only got a piece of the puzzle.
Yeah, absolutely.
So I've been working with Selectability for a few years now, and Selectability has a mental health focus. And within that, we have partnered with Lives Lived Well to run the ICE Help project. And I'm proud to say that the genesis of that was really from the ground up. So that came from a request from a family member saying, I am just really struggling here, my son is using ICE, I'm really struggling. And from that we developed services, but we also became acutely aware of how significant the damage is for families and how much they're dealing with, but fabulously also how significant it is in terms of an early intervention pathway for people with a substance misuse issue. And that's awesome, that's really great. Both sides of that are really great.
Yeah, I mean the research all shows that family connectivity and family support is one of the most important factors in success.
Yeah,
Yes.
Yes. In fact, with Selectability, we have an acronym called CHIME, which is connectedness, hope, identity, meaning, and empowerment. And if you consider all those in the person's context, family is really critical in there. Obviously, some people don't have awesome families. Some people have terrible families. But from my experience, there's an awful lot of fabulous families desperately trying to support their person with the misuse issue.
And your whole organisation is aimed to giving the families the skills and understanding they need to help the person that's got the problem?
Yeah, well, within the ICE Help project, what we're finding is we offer individual counselling, couples counselling if they want it, family counselling if they want it, and a group that we've been running for family and friends of ICE users.
This has been going for many years as well.
2 years. Two years. The group's been running continuously for 2 years, and people are reporting really great outcomes with that, which is great. And I think with regard to families' experience, particularly around ICE use, but any alcohol or drugs, is the feelings of guilt and shame and blame, and
for the family or
for families, yes. That so particularly parents, but often partners as well. Sometimes the children thereof, who are saying, where did we go wrong? What did we do? Why has our life become so chaotic? And so just the capacity to talk about that and share that sort of stuff really helps people to move forward. So I guess what we deal with largely are those kinds of things, that sort of deep pain for families, but also a little bit around the effects of the drug. So how is that impacting on the user? What level of impairment are we looking at? And that can help people in their communication strategies. Is just understanding that you're not talking to the person you were talking to before their use, you're talking to someone with significant impairment. Looking at the patterns of the use, like when would you be having these conversations? Not at this point, not at this point. Maybe there's this little
choose
window
the right
here.
spot. Yeah, that's right.
And just some general ideas around how you communicate that stuff. It's fairly evidence-based, like what do we know supports not using, and it's not the negative stuff, it's not the threat or the fear of imprisonment, etc. Those things tend to be good at stopping a behaviour starting, but once a behaviour has started, they're not very effective tools. In fact, what's more effective is focusing on or providing things that provide positives in a different direction. So that's really empowering.
Positive goals,
for
aiming people to aim for this is where I want to get to, those kind of positives?
No, not so much. Focusing on what life is like when you're not using, the positives about
the
what
quality
life's
of
like.
life.
Yeah.
with or without.
Yeah, and in really concrete terms. So families, for example, can nobody knows that person with the misuse problem better than their family. So we as clinicians can do that, but families know that stuff so well. Exactly.
Right.
So it's what would you suggest? What do you think would work for your person as a really positive experience? Is it the family dinner? Is it the family barbecues? Or is that terribly stressful? Okay, if that's terribly stressful, let's find another one. Families find that really empowering, and powerlessness is one of the key issues that we're finding with families. Is this thing that affects their life to the nth degree, which is in common with any mental health issue, but particularly around alcohol and drugs, but over which they have so little power. So that's really useful. So in terms of families, that's awesome. And in terms of that early intervention pathway, that's really exciting. When families know what services are out there, which ones are likely to be a good fit with their person, what are the barriers to their person using that, and looking at flexible and holistic ways of us interacting with their person, that's going to give us the best outcomes. So they're really your 24/7 case managers.
And when you talk about early intervention, can you give us more details about what that involves and how they run?
Okay, so an earlier connection with services, and so not only is it earlier
For the user.
for the person using may access those services earlier than they would ordinarily. So when there's less damage and at an earlier point, so increasing their chances of
success.
Exactly. A pathway to earlier intervention. So when families are able to provide that input that is really can really tailor make services to their person, we're looking at better outcomes and earlier connection.
Right.
And we can be very holistic about and very creative and flexible about how we connect with that person. It's not just us sitting back saying, come down if you're ready, but actually saying, what would work? What would help? Could we phone? Could we see them with you? Could we come to your place? So very, very flexible delivery of services.
So you are, in general terms, seeing the families before the patient is presenting to anybody.
Thank you for bringing up that point, because that's a really what is making this program particularly unique. A lot of places, if the user engages, then that service may or may not provide services for families. But what we're doing is families can access our services independently of their person using, and usually preceding their person using. So that's the bit that is exciting in a way, that it's a pathway to early intervention.
I was going to say, the strategies you're giving the families must be phenomenally more effective because they know what to do for a good outcome, rather than bumbling along with what they think, or the traditional ways of dealing with it is disciplinary and reactive and negative and separates everybody.
Absolutely. So in a way it allows us to deal with the family's grief, sense of hopelessness, relationship breakdown, all those bits we can deal with, which strengthens them to deal with the incredibly difficult stuff that they're dealing with. It also they're then your kind of 24/7 case managers, so they then are able to evaluate how the program's working, what's looking good, what's not looking so good,
and give feedback that's honest, whereas often the user might be not quite so disclosing to their professionals. So,
and saying, now's the time, now, can we do something now? Awesome. It's great.
It's a fantastic program, and I mean, it's a very unique program too, isn't it?
Well,
I mean, you've been doing this with this approach because of the desperate need that families have had.
The families are a demographic of need in their own right, huge need in their own right, but also as a pathway to early intervention. I think it's something we have not seized upon as a community, and we really need to. And in terms of the three pillars identified through the federal government and the state government, that reducing harms, reducing demand, reducing harms, reducing supply, families have a fabulous role to play in all three of those pillars, and I don't think it's an untapped resource. So I think it is a model we really need to roll out
across the country.
I really do. I really do. Families, and if you look at the person with the misuse issue, you can't take trauma out of the picture, and you can't see that person in isolation. That person operates in a system. So if you can provide a systems approach, if you can provide a strengths-based approach, which is what we're doing here, then I think we're on a positive pathway. It's not an easy fix. Anyone that works in that area knows that.
Yeah, that's right.
I think the other really awesome thing about the ICE Help project and the services that Selectability and Lives Lived Well have coupled together is that 18-month time frame, and that's awesome. It's a long-term issue. It's not a quick fix. So I think that's another really important part, is we need to be in it for the long haul.
That's right. And I mean, getting people to successful recovery, especially with ICE, takes a lot longer than the other drugs, doesn't it? And it is
got a very long tail.
Yeah, that's right. So I mean, any process does need to commit for a long time for it to be successful. So I think that is a very good point. What advice would you give a family who is struggling to support their family member who's in a crisis with drug use, but that person is causing them a lot of grief and causing them a lot of strife, possibly doing a lot of negative things within the household or the family? How do they continue to provide support while what they're getting back is negative, and how do you prevent that breakdown in the family structure?
I try to respond very individually to families, but as a general rule, I would say some fairly universal principles would be around self-care, that you can't give on an empty tank, so you have to have some good personal resources because you're living with extreme trauma. So some good self-care. I would say some boundaries about what you can tolerate or will tolerate and won't tolerate. Giving some thought to your communication strategy so that you've got a bit of a plan, which sounds simpler than it is, I know, but so that it's not just reactive. And I would say get some support for yourself, because this is big. It's really big stuff. It's not minor stuff. It's really big stuff.
And you provide all this kind of advice directly to the families when they need it. So come in and get help from Selectability.
Yeah, absolutely. I suppose the other thing I'd say is find out some information about what services are around. We know that the chances of success in trying to give up a substance are much greater if you seek professional support. We know that, statistically speaking. So perhaps as a family member, you're not going to be the person able to really very directly help that person stop their behaviours, but maybe make yourself aware of what's available and how to access it.
Encourage them in the right direction.
Yeah. And you might be able to help them with the first steps to that. You might be able to go with them to the first appointment, that kind of thing.
Yeah.
Because that first step's a big step.
A lot of users are reluctant to present themselves because they fear judgment or stigma and denigration almost. Obviously, as a professional in the field, what would you tell people in relation to that?
I would say that addiction is a very complex thing. I don't think it's as simple as pull yourself together, man. It's just not that.
That's right.
Most of us have our addictions in one way or another. That person just might be dealing with it on the extreme end of the continuum. It's a very rare person that is down the I don't have any behaviours that I would like to stop doing but find difficult to stop doing end of the continuum. We're all on that continuum somewhere along the line.
So there's no judgment, is really what you're saying.
Totally no judgment. Right. And let's look at what the goal is, and the goal is to change that behaviour. So it's not about judging that behaviour. Who does that help?
That's right.
No one at all.
So you're there to help, you don't judge, and you've obviously got many years of experience in this field in order to help the families and to get the users off in the right direction.
Yeah.
So do you want to tell us about the different programs you run for families directly?
Yep. So Selectability itself is changing focus a little bit and setting up as mental health clinics that'll be fee-free, which is really needed, absolutely needed. And apart from that, and that's very broad-based, so people can seek our services very broadly. And we do run some educare sessions, so generally they run as a 6-week, 2 hours a week session, and it'll cover such things as what is mental health, what is mental illness, self-care, communication strategies, grief and loss, mindfulness, along those kinds of lines. So as a general, upskill yourself thing in a group environment. And then Lives Lived Well, we also run the Life Back program, which is an alcohol and other drug use service, but in a group setting. That really works for some people. It's not it's not a one size fits all. None of this is a one size fits all, but that's another string to the Lives Lived Well bow.
That's getting people back into activities of daily living, or
no, more around exploring what are the common threads about how to manage your behaviours around stopping using or reducing using.
Right, okay.
And that's really useful for some people to go, oh my God, I thought it was only me. Actually, this is a problem we all share, and a problem shared is a problem halved kind of thing too. Plus, very evidence-based, we know that human behaviour is supported when in a group environment much more than just as in a solo environment. So that's the rationale behind those kinds of things. It's also behind why we run groups for families, is that group progress tends to be more sustainable than just individual.
And they get
progress.
strength. The people that are further down the track advise and show the success for the people that are in the middle of the crisis.
Yeah, and share strategies. Share each other's successes and griefs, really. And we've had some beautiful stories in those groups, I can tell you. People give up their substances all the time. Is it difficult? Yes, it is difficult, but it's doable and people do it all the time. And there are services that can help, but like anything, you keep looking till you find the fit that fits for you. Don't stop if you try one and it's not a good fit or it's not the right timing or whatever. Don't give up. You keep looking, and it can be done, and it can be done with support as well.
Yeah.
So that would be my take-home message.
I absolutely agree with you. Getting clean, recovering from addictions is possible. You need to make the decision, you need to take the action. Obviously, Selectability provides absolutely great support for families, and at the end of the day, having the family support around the user is one of the most important things for success. So thanks very much, Janice, for the interview, and
thanks, John.
we look forward to seeing you again.
Yeah, thank you.